how important I think the role of the CIO is going forward, and how I think it's going to change. What I said in my presentation was that it's important to understand the role technology plays as it relates to the business of the healthcare organization, but it's almost more important for the CIO to understand the whole business space and be considered a business person as opposed to a technology person. So I hope that that message came across loud and clear. I see the future going as healthcare organizations here and in other developed countries in the world try to cut costs in the healthcare delivery because of the aging population, among other things, and the huge number of chronic illnesses that we're having to deal with. Not necessarily the acute care space, so the whole healthcare is going to change dramatically over the next 10 to 20 years and move out of the acute care environment being the focal point and move into the ambulatory and community environment. And the CIO's got to figure out a way to make that happen. For starters, learning. For seconds, networking. It's really, really important that you attend events like this so that you understand what others are doing, so that you're not operating in a vacuum and trying to reinvent the wheel. Because I think healthcare is probably more complex than all other industries combined. For starters, it impacts all of us. For seconds, the people that are getting the services aren't the ones who are paying for them, which is, I mean, can you imagine buying a car and have somebody else do it for you? I mean, you know, or putting gas in the car. And I mean, healthcare has been local. It has been as opposed to, you know, there aren't the Chase Manhattans of healthcare, you know, or they just don't exist. So it's not like other industries that have had big players that have said this is the way we're going to go and everybody else salutes and does it. There's nobody in healthcare that big that can make stuff like that happen. Each country has a different way they finance it. I mean, it is just an incredibly complex environment, and the utilization of technology kind of reflects that. There's been all these silos and stovepipes of information systems that, you know, work in some organizations and don't in others, and I mean, so it's an incredibly difficult problem to solve. And what's happening now is organizations are trying to eliminate variability so that patients are treated consistently, you know, in a geography or in a country. Costs can be driven out because of the variability. Let me give you an example. So when I was a CIO, we were trying to standardize on hip replacements and the prosthesis that surgeons implant. And we were a real small place, and we had 14 different implants that we had to order in stock. Well, it's kind of stupid to spend that kind of money having 14 different implants that ostensibly all kind of do the same thing. So we got it down to 2 or 3, but that saved an enormous amount of money, you know, and established standardized practice and all that. So it's not just that the IT is behind, healthcare itself is behind in standardization and variability and all those, and quality for that matter. Well, all I know, the technology is about the same, but the adoption of the technology, Canada is behind the United States in the adoption of electronic patient records and the implementation of electronic patient records. From the numbers that I've seen, and these are as of the end of December 2012, Canada on the EMR adoption model, Canada has 3.1% of its hospitals at stage 4 or above, which is physicians doing orders electronically and nursing documentation, clinical data repositories, those technologies in place. The United States is a little better than 10 times more than that. It's 33%, 33.1 or something like that. So Canada's got some catching up to do just in that regard, but Canada is ahead of the U.S. in adoption of the technology in physician practices. So I'm not sure they even out, but there's considerable challenges to implementing the technology going forward for Canada, and, you know, just getting that stuff in place. But you're making a heck of a first. You've done well getting started on it. I enjoyed it. I've given talks on healthcare IT in 22 different countries, and it's real interesting to see the variability, but also the similarities in those systems and the CIOs. The CIOs are all dealing with the same issues. Some more so than others, but the same issues are happening in the UK as are happening in Norway, as are happening in Australia, as happening in the US, Canada. It's all there's not that much that's different. There's dramatically more that's the same. And so the more we can learn from each other, the better. And today, things like the thing today really help that.